Hi, I'm Dr. V. I'm an interventional pain physician at Bloor Pain Specialists. Today, I will be addressing some common questions about epidural steroid injections.
Is there a maximum number of times ESI can be repeated?
This is an excellent question and an evolving one. We continually look at the data, reassess in medicine. The information now tells us that by injecting epidural steroids, there are some long-term implications. For one, there are implications on the fatty tissue in the epidural space. It can grow. And if it grows, by changing local metabolism, having the same injection in the same area for the same disc and the same nerve, again and again every 6, 9 months, 12 months, over the course of a decade. Somebody might have a better quality of life. They might walk more, they might do more, they might be able to work more, they might enjoy their life more. But locally in that tissue, the metabolism changes, and a fatty deposit within the epidural space can grow. This is not visible through the skin. It's deep. It's actually within the spinal column, but it can occupy space that can make the nerves a little uncomfortable. And that can change the scenario of how somebody is treated in the long term. Another common consideration is the bone density changes that come with corticosteroids. Bones can weaken with the injection of cortisone or any cousin of cortisone. And we measure bone density with a measure of a 10-year risk of fracture. So if somebody has less than 10% risk of fracture over the next 10 years, they're thought to have normal bone density, to be low risk of having bone density complications. So if somebody is relatively young, they're athletic, they're strong, they have good nutrition, their fracture risk might be as low as 1%. And corticosteroids will increase the risk of fracture by an average of 21% over a 10-year span. That doesn't mean it goes from 1 to 22. It goes from 1 to 1.21%, which is a very small change. But it's an important one if somebody's starting off at 20% risk, 30% risk, 40% risk, if they've already had 2 fractures, 3 fractures, 4 fractures. Those are the patients that we really have to be worried about, thinking about what are the long-term implications, how many should this patient have, what are their risk downstream? Because they may be significant, and those complications may be a massive detriment to their life despite the relatively short-term or medium-term benefits of the epidural steroid injections. If you have any general questions you'd like us to discuss, please leave a comment below. If you'd like to discuss anything specific about your care, please contact our clinic. Don't forget to like and subscribe. Thank you for watching this video.